Pushing at delivery. I swear social media must push those videos out into people's feeds because there are so many videos encouraging you on when and how and where to push. And today I'm excited to give you my 20 years of labor and delivery experience combined with all of the studies that I have read about the best way to push. Okay, in this video, we're going to talk about when, where, and how to push. And I'm excited to kind of break it up into those different things. So first off, we're going to jump into when. When do you push? Most people believe that when you push is when the cervix is behind the baby's head. Now, I want you to understand what that completely means. So as the baby is going through the uterus, the head will come out and the cervix will pop behind the baby's head. And when we go in to check you, we will not feel any cervix. And that is when you are 10 centimeters complete or fully dilated. That means that we don't feel any cervix. I know a lot of people are concerned that we are measuring it wrong, so we don't know when they're actually able to push, but it is just we don't feel any more cervix. Fun fact, if you were to push before that cervix has completely disappeared, especially without kind of supervision, you can actually tear your cervix. So that's something that's important to know, and it's why we often want to check you before you start pushing just to make sure that the cervix is gone. There are things that we can do to try and help that cervix slip behind the baby's head, but they don't always work, and they can actually make the cervix swell, which we do not want to have happen. That's something important to know as well. Now, there are two trains of thought on this. You can do delayed pushing, where if the baby is still high up in the pelvis, we wait to push, or you can do immediate pushing, which means once we find out that you're complete, you start pushing. Let's do a quick reminder of the station. This is one of the things that we're checking for when we check your cervix. It's how high in the birth canal the baby is. So when the baby's head is even with these ischial spines, which is the bottom of your pelvis, or they're those bones that you sit on, then that is zero station. And then this is +1, +2, get the doctor, we're going to have a baby. But -1, -2, -3 means that, baby is above those ischial spines. So sometimes when you come into labor and delivery, on our first check, we'll just say baby is high because they're up here. And that's really important to know as we're talking about this delayed pushing. Now, recent studies have shown that delayed pushing can actually increase your chances of an infection in either the uterus or the amniotic fluid called chorioamnitis, or postpartum hemorrhage. Now, I think it's also really important to know that if you are having an induction of labor, your chances of chorioamnitis and postpartum hemorrhage actually increase as well. So you got to look at your situation, what has happened in the past, what's happening right now. Now, that has made some providers say, you're complete, we're going to push right away because we don't want to increase those chances. But I am here to remind you that when you decide to push, it is always up to you, not up to your provider. So there are going to be reasons why you might want to delay pushing. You want to take into the risks and the benefits. Let's say you were 8 centimeters, you were miserable, you got an epidural. We go to put in your Foley catheter, which, by the way, if you want more information about the Foley, I'll put a link for it down below. And then we check your cervix and we find out that you're fully complete, but you are exhausted. So this might be a great opportunity for you to use that epidural and delay pushing a half an hour, especially if baby is still high, like we were talking about with my crocheted pelvis, to let the baby come down a little bit, let your body relax a little bit, and fill up your gas tank with a little bit of energy before you engage in pushing. Let's say that baby is still really high. Maybe this is a good opportunity to use some positioning. It's really important that we use other things, not just like chill out at the nurse's station, to help that baby descend during delayed pushing. It's not just a time to rest, unless of course you are exhausted, but it is a time to use your body, to use gravity to help baby descend into the birth canal. Another reason a lot of people want to delay pushing is that they are not feeling anything. They don't feel an urge to push. And so if you're going natural, most people end up having that urge pretty quickly. If you have an epidural, we can actually turn down the epidural a little bit, wait a little bit, and then you'll have that urge to push and you can start pushing. Remember, pushing is always up to you, but you're going to want to take into account the risks and the benefits before you make your choice. Now, I didn't really mention the benefit of delayed pushing, and the idea was that mom would have to engage and push less and be less exhausted when baby is born, which I'm absolutely here for, but you got to balance that with the increased infection and hemorrhage rates. The other thing is that I did see nurses who would delay pushing for 3 hours, just sitting at the nurse's station to sort of shove that delivery onto the next shift. That's just the lazy way out. And so I'm glad that we are putting, some brakes on things like that. That probably was not the best patient care. And if we're delaying pushing, I'm thinking 30 minutes to maybe an hour versus these 3, 4-hour things that I sometimes saw nurses doing, so that again, that delivery could happen on the next shift. Which, by the way, if you're loving me pulling back the curtain on tips like this video is actually sponsored by the online prenatal class for couples. It has a whole section on what to do with delivery and how to push and things like that. So you guys are going to want to check it out. I'm going to put the link for it down below. But it has so many tips just like that one, pulling you back the curtain on what actually happens in labor and delivery for you guys. Okay, where do you push? Well, most of you are going to push in the hospital if you're watching Hillary, the Pregnancy Nurse, where we get you prepared, not scared, for your hospital birth. But where you push really means what position are you going to push in. So before we start on this, I want to talk that there are sort of 2 phases to pushing. The first one is when baby is high, we don't see the head, and you're pushing baby down into the birth canal. The second one is when baby is starting to crown. Now, I do not have a perineum here. I just have a pelvis. But as baby is starting to come out, that starts to really stretch the perineum, which is where the birth canal meets your skin. And this is a point in time where you really want someone to come. This is the point in time where the nurses will call your provider. If you want somebody in the room the whole time that you're pushing, I would encourage you to check out a certified nurse midwife, because they tend to be around more than an OBGYN. But, when baby is still up high, that's different than when we're pushing and we're really trying to protect that perineum. And a lot of people online don't make the distinction, because when the baby is still high, you can really push in whatever position you want to be able to push in. Now, if you have an epidural, most likely those positions are going to be on the bed. But if you don't have an epidural, you can push in lots of different positions and you can use the room as you want, especially if we have wireless monitoring going on. I have a whole video on wireless monitoring. I'm going to put the link for that one down below. But, use your room, use the things in the room to help you be able to get in positions that feel good to push in. Fun fact, if you were going naturally, once that cervix is behind the baby's head and you're able to push, a lot of people feel like it feels better because they're able to push against the pain. So if you're planning on going natural, I think that's a really good thing to know, because a lot of people think, oh, is it going to get even worse when I start pushing? And I'm here to tell you, it actually feels a little bit better. Now, it is that second part of pushing, once the head is starting to press against the perineum, usually once we have your OBGYN come, that we're really wanting to protect that area as the baby's head comes out. As a note, usually this is the last 5 to 20 minutes before delivery. Now, some OBGYN providers will only deliver you on your back. I would have patients in even a lateral position while they were pushing, and I would see doctors come in, give me an eye roll, and tell me to get her on her back. I think it's important to bring up at your prenatal appointments if how you push in the last parts of your delivery is important to you. Ask your provider how they most often deliver patients in the delivery room. See what their response is. I think it's a good indicator of how open they are to patients making their own choices at delivery, with this caveat. Providers are trained to protect that perineum with your legs up in the stirrups and in that position. That is how they have all been trained to do it. Editor Hillary here to say that if you're like, I don't know how to bring this up with my provider, on my Birth Plans Made Easy, which is a free little thing I'll link to down below, I actually have a spot on what position you'd like to deliver in. So that's kind of an easy way to bring it up to your provider. I think it's a great thing to bring to prenatal appointments, to just kind of give your provider a heads up on what you're hoping for, so that you can start having these discussions early on. And it's an easy way to bring up those kind of discussions that can feel a little bit tricky sometimes. So I'll link that one down below. Now, am I here to say we need to train them to do it in other ways? I absolutely am. But that is the best way for them to visualize what's going on and protect that perineum at delivery. Now, another important thing to note is that no matter how you deliver, if you deliver squatting in the bathtub, most often we are going to bring you back to that bed and put you up in the stirrups so that they can visualize your birth canal to make sure that there aren't any tears or anything that they need to look at. So a lot of people don't realize that. And then when we're pulling out the stirrups, they're like, wait, the baby's already out. But that is the best way for the doctor to visualize if they need to sew anything up. And you definitely want them to be able to do their best work at that point in time. Now, what do the studies show? Now, I hear a lot of people say that specific ways hurt your pelvic floor to push in them. And I'm here to tell you that your pelvic floor is going to go through a lot during pushing. And sometimes what we are doing to get that baby out is probably not going to be the best for your pelvic floor, but we have to push that baby out. Your pelvic floor was made to extend a lot to allow the baby to come out. But it might take a little bit of physical therapy to rehab that pelvic floor after you have your baby. The studies show that there is no one right way to push in that first part of pushing. All of them say shared decision making, which ultimately means the patient gets to decide and we kind of tell them the risks and the benefits or how they're doing in certain positions. The main studies do talk about tearing, however, because that's something that is really easy to quantify. If a patient tore, how much they tore. Studies do show that the best way to push is either on all fours or kneeling, both of which are hard to do with an epidural. We're going to talk about that in a second. And the worst way to push is actually squatting. Personally, I think the squatting thing, it makes your perineum stretch a little bit, but also providers have a really hard time if you are actually just squatting, helping to protect that perineum. Now, with an epidural, a lot of people will say, oh, you can still be on all fours. And I'm here to tell you that you get about 4 good pushes out of having an epidural and being on all fours. Not everyone, but most people, because your hips just start to hurt. You just don't have the muscle tone to be able to be on all fours for an extended period of time when you have an epidural. So I think that's something that's really important to know. But if you don't have an epidural, all fours or kneeling, you would think all fours, the provider still has a really good view on the perineum and can still really help to protect it. So I'm hoping that in medical school, they're helping them learn how to protect that perineum, even on all fours or kneeling or squatting. I'm hoping we're learning how to do that. And here's a point where I say there are a lot of videos from physical therapists showing how patients should push at delivery, but because they have not pushed with lots of patients, they don't seem to really understand that there is no one right way to push for everyone. Everyone's body is different. Everyone responds in different ways. Everyone bears down in different ways. And so it's really important to try a few different things and see what is working for you at delivery. And this is all actually a post on my website. I'm going to link it down below so you guys can watch it. 3 things I want you guys to remember. Try a few different positions. Remember that your delivery position may be different than your pushing position. Again, that delivery position will be just the last few minutes of your delivery. And talk with your provider. See what they are wanting if you are wanting to not push on your back with a feet in the stirrups, which is what most of them, that's their standard way of delivering patients. And fun fact, in the online prenatal class for couples, there are some labor movement cards that give you some ideas on ways to move, both during pushing and during labor, to make movement an important part of your labor. Okay, now is how. How do you push? I think a lot of people wonder that. I'm here to tell you that you're going to be using the same muscles that you use to poop as when you push out your baby. And a lot of people freak out that they are going to poop. I actually have a whole video about that I'm going to link down below. No one in the room cares about it because when I see a patient who is pooping, I know that they are using the right muscles to push out their baby. I'm happy to wipe it away and we just move on. Do not worry about that one at all. Now, there are 2 thoughts of pushing. There is open glottal pushing where you pull in that breath and then you kind of moan as you push down. Oh, right? You're letting the air out as you push the baby down. The glottis is something at the back of your throat that closes off your windpipe so the air does or does not come out. It keeps us from choking. Big fan of the glottis. There's another one called closed glottis pushing where you pull in your breath and then you bear down without any air coming out. Now, I see a lot of physical therapists and people saying that closed glottis pushing often does trauma to your pelvic floor. And I'm here to remind you that sometimes we have to traumatize your pelvic floor a little bit in order to get the baby out. If everyone could do open glottis pushing and kind of gently push down on their baby to deliver it, that would be great. And a lot of times, especially if it's your second baby, that is something that you can pretty easily do. You're not just banging them down on them with a very hard push from your diaphragm. You're letting that baby descend a little bit more naturally. However, on your first baby, average pushing time is about 2 hours. And for some people, when they open glottis push, they just don't push with a lot of effort to really get that baby to come out. You have to remember that when you're pushing, the baby goes down. And then when you're done pushing, the baby goes up a little bit. So, if that's at the bottom of the pelvis and we're crowning, we see the baby come down and then they go up a little bit when you're done pushing. And so if you don't give a good push to get this baby down quite a bit when you stop pushing, then really nothing has happened. And so sometimes closed glottis pushing is going to be your best way to push your baby out. And just like positioning, I think it's important that you try open glottis pushing, try closed glottis pushing, see which one you like better. Ask your nurse which one is working better to get the baby to descend. And it doesn't mean just because you pick to do closed glottis pushing right now, it doesn't mean that you couldn't do some open glottis pushing, especially right at delivery, because at delivery time, your provider is going to give you some specific instructions to let that that perineum stretch over the baby's head rather than just like busting out of it with your baby's head. As you can imagine, that is not the best thing for your perineum. And when you look at the studies, they absolutely support this. There is one study that I read that encouraged open glottis pushing, especially on second plus babies, which again, I mentioned, because you just don't need as much force because all of that has been stretched out before to get the baby out of the birth canal. And I love that you are here learning about pushing, but I got to ask, is your partner educated in pushing? A lot of them think, oh, we're 10 centimeters, the baby's just going to show up. But they need to know also that there is a great deal of work ahead of them to get this baby out. So I would encourage you to join with them in the online prenatal class for couples so that they get prepared for all things labor, pregnancy, birth, and postpartum. Now, a lot of this video has been about preventing tears. So I have a whole video on how to prevent tears. Some of that is about pushing, but there's other things that we can do while we're pushing that I think you guys will really enjoy. As a reminder, pushing is very personal. So just because someone pushed out their baby one way doesn't always mean that it will work for you. So try lots of different things and ask your healthcare team to give you ideas as you push moving forward. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.